In this video, I'm going to go over some tips for a torn labrum of the shoulder if you decided not to or you're not a candidate for surgery. Where is the labrum and what is its function? So the labrum is a collection of fibrocartilage that is right here inside the shoulder joint. Basically what it does is it deepens the socket for the glenoid fossa. So on your shoulder blade or your scapula, you've got this kind of depression that the humeral head or the ball fits into, and so the labrum deepens that socket, creating more stability for the joint. It is common to have tears in this area, especially overhead athletes to have something that's called a slap tear, superior labral anterior posterior tear. There are also other types of tears of the labrum. So we're going to discuss strengthening techniques that you can do to try to create stability and return function to your upper extremity. The first thing we need to do is make sure that you have adequate range of motion. Now, if you don't have enough range of motion to start with, then you need to be doing things like tabletop slides. You've seen those in my previous videos where I take one hand over the other and slide on top of the table. So we're going to say for this video that you are able to raise your arm up, maybe not all the way, but there is some range of motion available there. So you're going to take a piece of PVC pipe, you can take a walking cane, a broom handle, just whatever. We're going to say it's my right shoulder that's affected. And what I'm going to do is use my left arm to do most of the work to bring my right arm up. And I'm going to go up as high as I can comfortably. It's okay if you have some pain with this. If you feel like your shoulder joint is popping or it's going to slip out of place, then definitely back off. Don't go up as high. But I'm just going to go up as high as I can tolerate, however high that is, and come back down, nice, slow, and controlled. And repeat that for 2 to 3 sets of 10 to 20 repetitions, and that's something I would perform several times a day. Now we're going to begin rotator cuff strengthening exercises. We want to make sure and strengthen those 4 rotator cuff muscles as well as the bicep that helps stabilize the shoulder joint. The first one you're going to do is going to be external rotation, elbow by your side here. You're going to kind of just come out just like this, and your hand's going to come back in. You're going to go out as far as you can. Initially, this may be painful, especially with certain types of labral tears, maybe uncomfortable to go out. So you may have to start with step outs or walk outs where you hold it in this position, just step back and forth, just statically where there's no movement. I repeat that for 2 to 3 sets of 10 to 12 repetitions. Or if your pain allows, then you can go all the way out just like this. If you have trouble keeping your elbow next to your side, you can take a towel, roll it up, put it under the elbow, and start right here. But that's a really great exercise to strengthen that posterior cuff or rear aspect of the rotator cuff complex. Next, we're going to perform scapular retraction or rows. I'm going to take that same band and have it fastened over here in the door. And I'm just going to pull back. I'm really feeling that in the back of my shoulder there as I squeeze, kind of squeeze my shoulder blade around, coming around my ribs. I'm going to perform 2 to 3 sets of 10 to 15 repetitions of this exercise. And as always, if you aren't able to perform that repeated movement, you can just keep the elbow by the side. You can step back the same way as we did that going out to the side with that external rotation. You can hold your elbow at the side, step back and step forwards, and do it the same way as far as the reps and a set scheme. Now we're going to perform internal rotation. So you're going to take that same band fastened over at the door, elbow by my side, and pull the band in towards my torso. 2 to 3 sets, 10 to 15 repetitions. And with this, just like the other exercises, if that's too painful, too uncomfortable, if it strains that labral area in the front part of the shoulder too much, you can tuck the elbow in and just step out to the side and then step back, step out to the side and then step back, just keeping that arm static. And that works really well to progress up towards where you can perform it actively where there's joint movement. These are going to be scapular protractions or presses. What you're going to do is take the band, push out, just like you're performing a chest press or a dumbbell press. I'm just going to press this out forwards and come back nice and controlled. As far as the plane of movement, it doesn't have to be exactly straight on what's called the sagittal plane. It may be a little out to the side or whatever feels comfortable to you, but I will caution you not to go super wide when you're pressing that out, because as you open up the shoulder there, you may get some discomfort in that labral area, and it may cause some subluxation in the shoulder, or you could cause maybe a dislocation. So just be cautious there and perform 2 to 3 sets of 10 to 15 repetitions. These are pull downs, really focusing on the mid to lower trap area. What you're going to do is keep your elbows straight, and I'm going to pull down on the band, really squeezing my shoulder blades together, pulling down, keeping the elbow straight. Really feel that in my mid to low back area, in that thoracic spine, lower thoracic spine. And I'm just going to do that for 2 to 3 sets, 10 to 15 repetitions. And that's something you want to make sure that you strengthen the lower trap and the middle trap area, because that helps with scapular or shoulder blade rotation. So when you raise your arm overhead, that's really important that you have those muscles strong, because they do assist that movement from the scapular standpoint. Now we're going to perform bicep curls. The long head bicep tendon does travel over the top of the humeral head as it goes into the shoulder joint. So it almost acts like a shoulder depressor at sometimes, kind of like the rotator cuff. So we want to make sure that we strengthen that, and it also assists with shoulder flexion or elevation, raising the arm out in front overhead. So we're just going to go with bicep curls. You can vary this, you can vary the hand position, you can go a little wider if you'd like, you can bring it in more narrow, doesn't really matter. If you're using dumbbells, you can start off with the palms in a neutral position and then kind of rotate them up as you come up. Any of that is fine. You're going to repeat that for 2 to 3 sets of 10 to 15 repetitions. These are Scap Raises, and so you're going to take that same band that you're using. You may have to go down to a lighter band, and you see how I have my hands facing each other. My thumbs will be pointing straight up if I put my thumbs up there, and you're going to go down and back up. This is not straight in the front, not straight out to the side, almost like in the shape of a V. You're going to go up as high as you can and come back down. Nice, slow, and controlled. 2 to 3 sets of 10 to 15 repetitions. Next is a motor control exercise. I call these ship wheels. You're going to take a band, pull it apart. You want to have it so that the thumbs stay facing each other. And I'm just going to move this around. Nice, slow, and controlled, keeping my thumbs pointing towards each other. I'd repeat that for 2 to 3 sets of 10 to 15 repetitions. To help improve kinesthetic awareness and also help to modulate some pain, I like to use a pulse device. So the pulse device is a vibration technology system. There are 2 of these in a set. They also come with a free downloadable app, and you put those on. They have an adhesive backing that's reusable. You put those on the areas around the shoulder that you're having some pain and discomfort. Turn them on, just kind of sit there, rest, relax. You can go through exercises. You can actually use the pulse device system while you're going through these exercises. They do have some guides in there and different ways and applications that you can use it. This is not a TENS unit, so it's not putting any kind of electrical stimulation to the muscles. It's a vibration technology, but it does really well at helping to improve that kinesthetic awareness to the joints and also the tissue. I definitely like the pulse device. Be sure and check them out. I'll put a link in the description that goes to pulse device. But again, that's a really neat product that's simple to use. And our last tip is something that a lot of us know how to use, and that's going to be using a hot pack or a heating pad. You can put that on the shoulder. Of course, you want to monitor the skin, make sure that you're safe to have a heating pad on. You don't have any skin conditions or blood clots or different things that doesn't allow that. You're going to use that heating pad every day just to improve blood flow to the area and try to help with some of your pain. Thanks so much for watching. I hope this video helps with your labral issues that you're having to try to improve your strength, stability, and range of motion. Thanks so much.